So I'm going to be doing a head-to-toe assessment for school, and the only person that's going to see it is my instructor. Are you okay with that?
Yes.
Okay. First I'm going to wash my hands. If at any point during the assessment you feel dizzy or uncomfortable or need to stop, let me know.
Okay.
I know you have a cold, some congestion, and a cough, so let me know if you need to take a break or if you need to stop, okay?
Okay.
Do you have any questions?
No.
Okay. The first thing I'm going to do is I'm just going to do a general inspection of your face, your skin, just check for uniformity. Alright, next I'm going to feel your head. Okay. Feel your hair. Okay. Alright. Next I'm going to have you smile for me. Good. Stick your tongue out. Good. Can you close your mouth and puff your cheeks out? Good. Can you clench your teeth? Good. I'm going to pull down on your chin and want you to resist your mouth opening. Good. Next I want you to squint your eyebrows. Good. Then close your teeth, your eyes real tight. Real tight. Good. Okay. Alright. While I'm looking at your mouth here, I'm going to have you open your mouth up for me, and I'm just going to take a look inside. Okay. Can you lift your tongue? Good. And then stick your tongue out real far and say ah. Okay. While I'm here, I'm going to check your nose. Okay. Can you cover one nostril with your finger and breathe out of it? No. Okay. And the next one? Okay. I'm also going to check your corneal reflex. So I'm going to shine a little light on your nose. Checking for your pupils. Good. Alright. Next I want to check your ocular movements. So I'm going to have you follow the pen light with your eyes without moving your head, okay? Okay. Alright. Next I'm going to check your pupils to make sure that they're equal and reactive to light. I want you to look straight ahead. Okay? Alright, next I'm going to have you cover one eye with your hand. I'm going to cover the opposite eye, and I'm going to move the pen light in different fields of vision, and I want you to tell me when you can see the light by saying now. Okay.
No. 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 No.
Okay. Keep your hand there. I'm just going to switch eyes. Right here.
No. No. No.
Good. All right. Can you switch eyes? Good.
No. No. No.
All right.
No. No. No.
Okay. All right. Right. Next, I'm going to have you do the reading test. If we were in the doctor's office, we would use a Snellen chart. But for now, I'm going to have you read a couple lines from this newspaper, hold it about 14 inches away from your face, and cover one of your eyes.
Designed to recognize speech and decrease other background noises, New Ear SDS is intended to help you better
That's good.
enjoy.
Alright, next one. Cover your eye.
Enjoy conversation and sounds that are meaningful to you. If you or someone you know has difficulty hearing, especially in noisy situations like restaurants and
one other test I would check would be your gag reflex if you're in the office, but we're not, so I would use a tongue depressor, but we're not going to check for that now. Okay.
Yep.
All right. Next, I'm going to palpate your sinuses. Any tenderness?
No.
Pressure. Okay. I'm going to palpate your temporal artery. Okay. Next, I'm going to palpate your TMJ. I'm going to have you open and close your mouth. Good. And then move your jaw to the right and the left. Okay. All right. Next, I'm going to check your ears. First, I'm just going to take a look at them. Okay. All right. Feel. Okay. I'm sorry, any tenderness?
No.
Alright. Next, I'm going to check for your hearing with a whisper test. I'm going to stand behind you and say some words, and I want you to repeat them, okay?
Okay. Soccer, football. Baseball, TV.
Good. Okay. Next, I'm going to palpate your neck. First, I'm just going to inspect it and making sure your trachea is midline, no deviation. Alright. I'm going to palpate for your lymph nodes. Okay. Okay. While I'm here, I'm going to have you shrug your shoulders. Good. I'm going to have you give you some resistance. Now you push up. Good. While I'm also here, I'm just going to check for your range of motion of your neck. Can you put your chin down and your head up? Can you put your head back at all? Good. I'm going to have you put your ear to your shoulder. Good. Up. Other ear. And then turn your head sideways. Other side. Good. Next, I'm going to resist that, okay? I'm going to have you push your head back. Good. All right. Push your head down. Good. Push your head to the right or left, I guess. Okay. And then push your head down. Good. All right. Any pain?
No.
No. Okay. All right. So, I inspected your neck. I'm going to go around back and check your thyroid. Okay. I'm going to just have you swallow for me. Good. Okay. Next, I'm just checking your back, making sure the contour is regular, no masses, even. All right. I'm going to check your spiny processes, vertebrae. Any pain?
No.
Okay. All right. I'm going to have you take a deep breath. Good. Next, I'm going to check for CVA tenderness. Any pain?
No.
Any pain?
No.
Okay. All right. While I'm back here, I'm going to listen to your lungs. I'm going to have you take some deep breaths, okay?
Okay.
Deep breath. Good. breaths. Good. And last one. Good. Okay. Next, I'm just going to continue checking your lung sounds from the front. Okay. And have you taken deep breaths again. And one more. Good. Okay. I'm going to check for murmurs. I'm actually going to have you lean forward and listen with the bell of my stethoscope. I'm going to have you take a deep breath. Hold it. One more deep breath. Hold it. And exhale. Good. Okay. I'm going to check my sheet before I have you lie down. Alright. I'm going to have you lie down at a 45-degree angle. Okay. Just inspecting the contour of your chest, and checking your carotid arteries and for any jugular distension. I'm actually going to palpate your carotid arteries one at a time. Good. Good. Okay. I'm now going to listen to your heart sounds. Good. Okay, I'm just going to turn my stethoscope to the bow. Oops. Listen to your heart sounds again. Okay. You can tolerate it. I'm going to have you lean slightly on your left side towards me. I'm going to listen for murmurs. Good. Okay. Alright. How you doing?
Good.
Okay. I'm actually going to get rid of this pillow here. Have you lie flat. Oops, hang on. I'll put this pillow under your head. There you go. I'm actually going to listen to your heart sounds one more time while you're lying flat. Okay. Good. Turning my stethoscope for the bow. Okay. And one more time, if you can tolerate it, turn to your left side and listen for any murmurs in your apical pulse. Good. Okay. You okay lying flat?
Mm-hmm.
Okay, next I'm going to listen to your abdomen. Okay, starting with your right lower quadrant, listening for bowel sounds. Okay, next I'm going to listen to your arteries, starting with your aorta. Checking for bruits. Okay. Whoops. Next I'm going to palpate your abdomen. Let me know if you feel any pain.
No.
Next, I'm going to percuss your abdomen. Alright, next I'm going to move down to your legs. Just inspecting your legs, checking for color, temperature, any wounds. Alright, looks good. Alright, while I'm here, I'm going to palpate your pulses. Checking your popliteal. Good. Good. Moving down, I'm going to palpate your posterior tibial pulse. Good. Now your dorsalis pedis. Good. I'm going to check for capillary refill while I'm here. Your toes. Inspect your toes. Do you have any numbness or tingling in your legs?
No.
Okay. Next I'm going to have you put your feet up and point your toes towards yourself. Good, and then point it down. Good. Now I'm going to resist that. I'm going to have you push your toes up again. Good. Push them down. Good. Alright, next I'm going to have you clench your toes. Good. You relax them. Spread your toes out. Okay, next I'm going to have you rotate your feet in. Rotate them out. Can you wiggle your toes or move your feet? Excellent. Okay, next I'm going to resist your knees from moving. I'm going to put your knees together. Knees together. There we go. Now can you turn your feet out? Good. Turn them in. Good. Okay. Alright, while I'm here I'm going to check your range of motion of your hips. Can you put your right leg up? As far as you can. Good. And down. And your left leg. Up and down. Good. Alright, I'm going to have you take that left leg and rotate it over your leg. Other leg. Good. And back. Good. Right leg. Over your left leg. Going over our left leg and out. Good. Okay. Alright. Next I'm going to have you rotate your leg out, and I'm going to have you, I'm going to resist that a bit. Okay, so rotate that left leg out. Good. And in. Good. Right leg out. Good. And in. Good. Okay. While I'm here, I'm going to have you take that left leg and run it down your shin of your right leg. Good. And the other side. Good. Okay. Next, I'm going to have you bend your knee for me. I'm going to check foot up. Good. And I'm going to have you rotate your knee in and out. Good. And you put your foot down. And the other leg. Knee in and out. Alright. Any pain?
Mm-hmm.
No? Okay, while you're lying here, I'm going to check your sensation. I'm going to get a soft cotton ball and I'm going to touch different parts of your body with your eyes closed. And I want you to tell me when you can feel it, okay?
Mm-hmm.
Okay, it's closed. Okay. And just let me know where you can feel something, okay?
Left foot.
Okay.
Right knee. Left hand. Right elbow.
Good. Okay. Alright. Next, you can open your eyes. I'm going to have you sit up for me. Good. Okay. Alright. Now we're going to check some more range of motion. I'm going to check your telereflex. Okay. Good. Alright. Next, I'm going to have you kick your foot up, but I'm going to resist it, okay? Foot up. Good. And then pull back. Good. Other side. And pull back. Good. Alright. the same thing with your arms. So I'm gonna have you put your arms up, and I'm gonna have you resist me as I want you to put your arms back towards you. I'm gonna resist it. Good, and then push down. Good. Okay, you can relax. While I'm here, I'm gonna just check your skin. Check for capillary refill. Good. Have a hand. Good. All right. I'm also gonna check your position. So I'm gonna have you close your eyes, and I want you to tell me if I'm putting a finger up or down.
Up. Down.
Good.
Up. Up.
Good. I'm gonna check your hand.
Down. Down.
Okay.
Up.
Good. Okay. Next, I'm gonna check your pulses. Your radial. Brachial. I'm gonna check your lymph nodes while I'm here. Good. Other side. Radial. Brachial. And your lymph nodes. Alright. I'm also going to check for your stereogenesis. I'm going to put an object in your hand. I'm going to have you close your eyes, and I want you to tell me what that object is, okay? Eyes closed?
Mm-hmm.
Okay.
A key.
Okay.
Battery.
Good. Okay. You can open your eyes. Alright. I'm also going to continue to check some of your range of motion. Okay? I want you to put your arms up for your hands up for me. And then rotate your hands. Good. Hands down. Can you put your wrist down? Good. Wrist up. Good. I'm going to have you close your hands. Open them. Good. I'm going to actually have you put your wrist down. And I want you to try to put your wrist up. I'm going to resist it. Good. And then wrist down like this. And I'm going to have, actually go like this. Sorry. I'm going to have you try to push back. Sorry. Try to go like this. Okay.
Oh, sorry.
Alright. Alright, next while we're here, I'm going to, do you have any questions so far?
No, I don't have any.
Okay. Alright, we're almost done here. Next I'm going to have you stand up. Good. And I'm going to have you reach over and touch your toes. And hold it there. I'm just checking your back for the contour. Good. Alright, stand up. Next I'm going to check your Romberg sign. I want you to stand with your eyes closed. I'm going to stay next to you. 15 seconds. Good. Alright, you can open your eyes. Alright, next I'm going to have you stand on one foot. Move your right leg up. Good. And I'm going to have you do a little bend. Good. Alright. Other foot. Good. Alright. Next I'm going to have you take a couple steps normally. Just walk normal over there. Good. Come back. I'm going to have you go heel to toe. Heel to toe. Okay. Excellent. Next I'm going to have you walk back that way on your toes. Good. And finally I'm going to have you walk back towards me on your heels. Alright. Good. Alright, I think we are all done. Thank you for your cooperation.